Follow step 1 through 3 for all dental radiographic exposures before the procedure begins. In this video, we will use the rinse. The beam alignment device is the preferred method because it includes aiming rings that aid in the alignment of the tube head with the receptor. Also, they are simple to position. Open the sterilized package and assemble the anterior instrument XCP first. When exposing periapical receptors, it is preferred to begin with the anterior teeth, which include canines and incisors, so all front teeth, canine to canine. It is preferred to start with anteriors because size 1 receptor is used and is small. Therefore, it is more comfortable and easier for the patient to tolerate. The size 1 receptor is placed with the long portion of the receptor in an up and down direction. For anterior exposures, individual images of each tooth must be obtained. On Dexter, this consists of a total of 8 anterior images, which means we're taking 5 maxillary exposures and 3 mandibular exposures. When placing the bite block of the ring on the receptor, make sure that the flat side or the blue side of the receptor is facing the teeth and the PID. Also, make sure the receptor is on the middle of the ring in order to avoid cone cuts and to expose the right area. We will begin with the upper right maxillary canine exposure, so that will be tooth number 6. In order to obtain a full image of number 6, the receptor must be placed on the center of number 6. In order to achieve parallelism, position the receptor towards the middle of the palate. So, meaning as far away from the teeth, and we want the receptor to be parallel to the teeth. So parallel to the long axis of the tooth which you are aiming to take the image. Then align the tube head with the ring by making sure that the primary beam is directed perpendicular at a right angle to the receptor and the tooth, and through the contact areas between teeth. Lastly, expose the receptor. For the maxillary lateral exposure, place the receptor on the center of the lateral tooth which you are aiming to take the exposure. In this case, we are going to place the receptor on the center of number 7. Position the receptor far from the teeth, meaning towards the middle of the palate and parallel to the long axis of the tooth. Once the receptor has been positioned, ask the patient to bite down slowly on the bite block. Then align the tube head with the ring by making sure that the primary beam is directed perpendicular and at a right angle to the receptor. Also, through the contact areas between teeth. So we want the receptor, the tooth, and the PID all parallel for these images. Once all this has been established, expose the receptor. For the maxillary central exposure, place the receptor between number 8 and 9. Position the receptor far from the teeth that you are trying to expose. So we want the receptor towards the middle of the palate and parallel to the long axis of the teeth. Then align the tube head with the ring and expose the receptor. Radiograph all the maxillary anterior teeth, so front teeth, canine to canine, from right to left by using the same steps and ending on the upper left maxillary canine, tooth number 11. Once all these exposures are done, move to the mandibular arch. You will need to expose 3 images for this arch, because the anatomy of the mandible is different from that of maxilla, and there is no need for 5 images. The first image will be the left mandibular canine, in which the receptor will be centered by tooth number 22. In this video, we will demonstrate only the central mandibular exposure. If you were to take this image on a real patient, sometimes the tongue is helpful as a cushion. But for Dexter, we want to push the tongue away because it will only be in our way and make things more difficult. Position the receptor away from the teeth that you are trying to expose in order to achieve parallelism. Align the tube head with the ring by making sure that the primary beam is directed perpendicular and at a right angle to the receptor. Then expose the receptor. In this image, the entire crowns and roots of the 4 mandibular incisors, including the tips of the roots and the surrounding structures, should be visible.